Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, an innovative series with healthcare experts providing their deep insights into critical health issues so that we have more awareness on disease prevention and are able to maintain good health. I'm here at the Mount Sinai Health System, which is the oldest and the largest teaching hospital in the country, and I'm talking to the kidney cancer team. Joining me is Dr. Ketan Badani. He's the Vice Chair of Urology and Robotic Operations, System Director of Robotic Surgery at Mount Sinai Health System. He's also the Director of Comprehensive Kidney Cancer Center and Professor of Urology at the Icahn School of Medicine. Thank you so much for joining us, Dr. Badani.
Thank you.
Joining Dr. Badani, we have Ms. Jillian Capodice. She's the Assistant Professor, Department of Urology, and she also works at the Integrative Urology and Wellness for the Department of Urology, Icahn School of Medicine at the Mount Sinai Health System. Thank you so much, Ms. Capodice. And joining our esteemed panel is also Dr. Kai Sao. He's the Medical Director of the Rottenberg Treatment Center and also genitourinary oncologist at the Tisch Cancer Institute at the Mount Sinai Health System. Thank you all for joining us today, and a very important health topic. It's about kidney cancer. So I want to first talk to Dr. Badani. Why is this issue important? Because we know that many times it can be asymptomatic in the early stages.
Thank you, Renee. You're absolutely right. Early kidney cancer is asymptomatic. The reason why we're here talking about this disease is because there is not a lot of awareness about it. You know, the American Cancer Society rates kidney cancer as a top 10 most common cancer in men and women. So this is not an uncommon disease. But we hear a lot about prostate cancer,
Right.
breast cancer, lung, colon, which are a little bit more common than kidney, but kidney is a top 10 cancer, and we should be discussing this more.
Right. So what do you see as signs and symptoms later on?
Yeah. The best part about this particular disease, I mean, having cancer is never good, but there are definitely good cancers and bad cancers. Early kidney cancer, when diagnosed early, is one of the most curable solid cancers in the human body. So it's a really good one when it's early. It's also a really bad one when it's late.
Right.
And so the interesting thing about kidney cancer is the majority of these cancers are diagnosed what we call incidentally or by accident. Yeah. What that means is, say you have a tummy ache, your back hurts, you're nauseated, something's wrong with you.
Right.
You go to the emergency room, and especially in the United States, it's far more common, you get a CAT scan.
Right.
It's very easy to get a CAT scan in the emergency room. And so although you went in for a certain symptom, you end up being diagnosed with a kidney tumor, which has nothing to do with why you came in. And this is called an incidental cancer. And I would say probably somewhere around 80%, 70%, high number of these diagnoses are incidental.
So how is it treated?
Early kidney cancer is
Yes.
treated primarily by surgical removal. There are other options. You can destroy the tumor by heating it or freezing it. But the most common way and the most definitive way is to remove it. And one of the really good things about early kidney cancer is it's not just very curable, you can also save the majority of the kidney.
Okay.
One of the really important technical aspects, and this is true for anyone who's been diagnosed with an early kidney cancer, is the vast majority of them, you can remove the tumor and keep the healthy kidney. And the cure rates are still just as good.
So is that partial nephrectomy?
This is called a partial nephrectomy, exactly.
So how successful is that?
Yeah, extremely successful. If you look at the history of this, we used to take the whole kidney out when we had a kidney tumor, even if it was a small tumor somewhere on the kidney. And the cure rates were in the 90% range lifetime. I mean, very good for the early kidney cancers. And then slowly we started doing these partial nephrectomies, but they're a little bit more challenging, they're a little bit more difficult, so they weren't done quite as often as they were supposed to be. Now, I'd say in the last 5 years, it's really become the way to do it because there's a long-term advantage to saving kidney function, and we'll talk about that a little bit later in the show. So partial nephrectomy is almost a mandatory thing to do now when it's possible. Now, it's not always possible. Kidney tumors can grow very big. And they can grow very big without spreading. So that's a good thing. But in those situations, it may be difficult to save part of the kidney. 9 out of 10 times, I would say that we should be able to save part of the kidney.
So you talked earlier that, many times people would take the kidneys out earlier on, but nowadays we don't. We try to do it partial nephrectomy. So how important it is to have both the kidneys?
Great question. So you're absolutely right in the sense that people can live with one kidney, for sure. You know people who have donated their kidneys for transplant. Even at a young age, you can live with one kidney. Problem is, you don't know what happens to your one kidney over time. And there are a lot of things that are bad for kidneys, not just cancer. High blood pressure, diabetes, cholesterol, smoking, you name it, kidney stones. So the chance of going into kidney failure is higher with one kidney than if you have two kidneys. And so what we see is that although the cure rate for treating an early kidney cancer is exceptional, the kidney failure rate is much higher if you don't do a partial nephrectomy. So the survival rate, people live longer when they have better kidney function. That's why we do partial nephrectomy.
So someone's kidney can be saved with this, and it's
I mean, more times than not.
Yeah.
Obviously, it's it's like real estate. Size and location
Yes, of course.
Of the tumor in the kidney matters.
So each situation, each case is different.
Each situation's different. But even the complicated tumors that are a little bit bigger, that are a little bit deeper into the kidney, where we used to not want to do partial nephrectomy, we universally are able to do them, even in those challenging situations now.
So now you are the director of robotic surgery, on operations and that. How important is robotic surgery, and how successful is it?
Yeah, robotic surgery, and just to point out the sort of misnomer of the word robotic surgery, most people think that means that something is automatically doing an operation. And the truth is, what robotic surgery really is computer-assisted surgery. Nothing's happening automatically. So what we're able to do is do an operation with these big hands, The problem is you can't get these big hands through small openings. So you have to make a big cut to get your hands in to do an operation. Right. What the robotic approach does is it gives you these little small instruments that duplicate the motion of the human hand. So whatever I do, I can control the instruments inside the body through little holes. And so there are a lot of advantages to doing things this way. Obviously, anything minimally invasive will have a faster recovery rate, lower hospital stay, faster back to normal, back to work. But for kidney cancer specifically, there are two very important things you want to accomplish. Completely remove the tumor, save the kidney, and keep that kidney healthy.
Yes.
Robotic surgery, for places that do it well and do a lot of it, who have good experience with it, can do partial nephrectomy more successfully, even in challenging tumors, because you can see better robotically. You have different imaging modalities. You can use ultrasound at the same time. It's kind of like picture-in-picture view of a sports event. You see two things all together. The surgical challenge, as a surgeon who treats kidney cancer, is when you actually are cutting a tumor out, you have to stop the blood flow to the kidney. So you temporarily stop the blood flow, and the kidney holds its breath. Now, the kidney can hold its breath for a long time, but we don't want to exceed more than 25 minutes. But 20 minutes is better, 15 is better, 10 is better. So the faster you can cut the tumor out and sew the kidney back together and restore the blood flow, the better the remaining kidney is going to function. Right. And so what robotic surgery has shown, with a lot of data, including our own, that time is much faster.
We'll take a short break, and when we come back, I'll be talking to Dr. Badani about the clinical trials for kidney cancer patients right here at Mount Sinai Health System.
Hi guys, this is Amish. Watch Your Health Matters with Renee, because your health matters in every way. It's not just about physical health, it's about your mental health, your spiritual health. Only when all three are healthy will you actually lead a healthy life. So watch the show and have fun while watching it.
We're back, and you're watching Your Health Matters, and Your Health Matters this time is with our kidney cancer team with Mount Sinai Health System, Dr. Badani, Professor Capodice, and Dr. Sao. And I see you have these basketballs. That you had a defining event last week, right?
That's right. Thank you for pointing that out. So we had a kidney cancer awareness event, again,
Right.
in the sort of grand scheme of creating awareness of this common disease. And so what I did was I took March, which was Kidney Cancer
Right.
Awareness Month, actually, and the concept of March Madness, where I'm a very big basketball fan, and I put them together. And so we did this campaign on social media called Mount Sinai Free Throw Challenge.
Wow.
And so I want to invite your viewers to go on to any social media outlet, hashtag Mount Sinai Free Throw Challenge, and they can take a video of them shooting a free throw.
Wow.
Could be into a garbage can, could be into a real basketball
Wow.
hoop, could be into anything you want. We have some very creative people out there. And spread the word, spread the
right.
campaign. And we had some formal NBA players come and
Wow,
show
that's
support.
interesting. Wow.
And we had free throw machines in the hospital. It was a fun time, but it's more to raise awareness for kidney cancer
That is
health.
so important. We love
Yeah.
to play basketball right now, but we have to talk about it. But this is so important, raising the awareness, and this show is all about creating that more awareness with our viewers, so
right.
that we're able to prevent these kind of critical health conditions. Now, Mount Sinai is right in the forefront, conducting clinical trials for kidney cancer patients, and you're spearheading them.
Yeah, so my charge is to be, to sort of provide cutting edge treatment for kidney cancer.
Right.
And, outside of the surgical aspect, which is preserving normal kidney, curing the cancer, preventing complications, there's also other aspects that we still need to do better on. And so we have a series of clinical trials for our patients to participate in where we can augment their recovery and their function. One of the things we're doing, which is interesting and hasn't been done, is we're using stem cells. So we use stem cells in the knee, we use stem cells in the shoulders. People are doing that to regenerate some of these functions. We're using stem cells to regenerate kidney function.
Wow.
So if you have a partial nephrectomy, whatever you cut out of a kidney doesn't grow back,
Right.
unlike some other organs. So you lose that for life, that's it. But there may be a possibility to actually grow some of that back. And so this is a trial we're doing now on the surgical side.
So is it in the last stage, or?
No, we're actively recruiting now. So anyone who's having their kidney cancer treated here is eligible potentially for this trial. And then, of course, the other thing is to figure out the genetic aspects of kidney cancer. And there are different types, and there's different aggressiveness. Some are really aggressive, some are not. Now, thankfully, most are not. That's good.
Right.
But we really don't know the genetic landscape. So we've got very smart people at the Icahn School of Medicine we work with to take the tumors from the patients that we treat and start figuring out the genetic landscape so we can target treatments better.
Right. So, Dr. Badani, you talked about genetic landscape, and that's a very important part of the equation for kidney cancer or any chronic illness. So, let's talk about other factors that come into this equation, and that can create more risk for the person.
Yeah, I mean, there are some well-known risk factors and a lot we don't know. But actually, this is why I invited one of my close colleagues, Jillian Capodici, because she runs our integrative urology program and so specializes in lifestyle, holistic medicine,
Right.
Ayurvedic medicine, acupuncture,
Wonderful.
so many different aspects outside of the traditional medical side of things. So I'd love for Jillian to take that question.
Okay, thanks. So as Dr. Badani was saying before, kidney cancer is one of the top 10 cancers, but it's actually increasing in prevalence in the United States. And some of the things are modifiable risk factors, which means that a patient or a person can actually help to have a healthier lifestyle to control them. And the three main ones are smoking, tobacco cessation. The second one is staying a healthy weight. There's definitely some linkage between obesity and prevalence of kidney cancer, and then another linkage between the increasing prevalence of type 2 diabetes and that relationship potentially to kidney cancer. And finally, staying physically active actually is something else that is also tied to both obesity that could be a risk factor potentially for kidney cancer.
It's interesting you bring that up. Your audience obviously has a lot of South Asian population. So I'm going to ask the question, what about tobacco that's chewable or non-cigarette tobacco? Because
So
that's a very
That's
common
happening now.
thing.
There's this flavored tobacco
Yeah,
products that
yeah,
have come out.
yeah,
Yes.
and that's a common thing.
So that's a great question. There's less data on that, and also on the new types of smoking, which is vaping.
Yeah.
But still, the kidneys, because they act to filter waste from the body, they're still basically metabolizing and having to process the nicotine, which is the main drug in and even the chewing tobacco. So the kidneys are ultimately still being exposed. So it's still a risk factor for kidney cancer, definitely.
How about high blood pressure?
High blood pressure is also another risk factor. A lot of people don't know that the kidneys contribute probably 30% to cardiac output. So again, making sure that your blood pressure is under control and having a low sodium diet are two things that you can do to prevent, again, reduce your risk for both high blood pressure, cardiovascular disease, and kidney cancer ultimately.
And we know that if you're gonna, from my side, spare kidneys, save kidneys when you're treating cancer, then you got to keep those kidneys healthy.
Right.
And the number one kidney killer is high blood pressure.
Wow,
Yeah.
that's so important for
Yeah.
viewers to know about that. So always check their blood pressure
Yep.
on a regular
Yep.
basis. Anything to do with gender, like if men are more susceptible to kidney cancer than women?
Well, men, the prevalence is a little higher in men,
I see.
but the overall prevalence is still increasing in both men and women. And I think that mostly some of the genetic studies will point to some reasons why.
I see. And Dr. Badani, you mentioned that she also does a lot of holistic treatment,
Yeah.
so non-traditional methods to treat. Share that with our viewers.
Yeah, I always told you, my mom, my grandmother, my aunts, they're trying to
Right.
give me things all the time that
Right.
I don't know a lot about. But I trust you,
Right.
so you tell me.
Well, some of the things that are really important is diet, of course.
Of course.
And we do try to get people to reduce their amount of intake of animal protein. So that's something
I
important.
see.
People also always ask a lot about herbs. And some herbs are wonderful. Actually, about 25% or more of drugs that we use today actually come from herbs. So there's this concept that herbs and plants, they have these active phytochemicals in them, and when they become a drug, they're reduced down to a single chemical component. But when they're together, it's more like a food.
I see.
In Ayurvedic medicine, in traditional Chinese medicine, we use herbs kind of in traditional formulas. And while some of them are very beneficial, and you can go to a specialist to be treated for certain things, you do also have to be, on the other side, be aware of the safety and make sure that there's no interactions with anything that you're taking. So the herbal medicine does have a component, it does have a place, but in modern biomedicine, we do have to make sure that it's safe. One of the other things that I use is acupuncture, especially for smoking cessation. There are also some studies that have shown that it can be helpful for blood pressure as well. So we like to have, and I think we're doing it well here, like kind of a multimodal approach. Either reducing patients' risk before or taking care of patients after they've been treated by Dr. Badani and making sure their kidney stays healthy.
Yeah.
And I think one point she made that I think we should just focus on also is supplements are good,
Yes.
but they can also interact with the normal medications
Exactly,
you
I was about
take.
to say that.
And so that should always be overlooked by some professional who can guide the medicines and the supplements together.
Right.
Because one can definitely have an ill effect to a traditional medication.
Absolutely, and the side effects could be contraindications with the herbs,
Yeah.
so it has to be taken care of by a healthcare, a medical
Absolutely.
professional. That is, I think, so very important. We're going to take a quick break, and when we come back, we'll be talking to Dr. Sao as to what happens when kidney cancer spreads throughout the body, right after this.
Hello, I'm Jyotika Tangri. Please do watch Your Health Matters with Renee because your health really matters.
Hi, I'm Renee Mehrra, and you're watching Your Health Matters, and today's show is at the Mount Sinai Health System with our kidney cancer team, Dr. Badani, Professor Jillian Capodice, and Dr. Sao. Dr. Sao, tell us, we've been talking a lot about the treatments and preventive methods, but what happens when kidney cancer spreads, it metastasizes, and we're in different parts of the body? What treatment is available at that time?
Yes, Renee. So as a medical oncologist, I do see patients with advanced kidney cancer. And thankfully, in 2018, kidney cancer is treated very differently these days with precision medicine. So back in the 1980s and 90s, we used to use chemotherapy for kidney cancer. Wasn't very effective. People had a lot of toxicity to the treatment. From then, we move on to the 1990s to early 2000s, where we use a class of therapy called immunomodulatory therapies, where we stimulate the patient's immune systems to attack the cancer cells, but also was very toxic, and it worked for only a small subset of patients. Back in the mid-2000s, we had then developed a class of medications that's aimed to control the blood growth process of the cancers. So these are called anti-angiogenesis tyrosine kinase inhibitors, where patients, by taking pills at home, they can control their cancer for a duration of period of time. So for years, we have these tyrosine kinase inhibitors who control the cancer, but at the same time, when they fail, we tend to run out of treatment options or viable treatment options. And then the years following, we had developed other tyrosine kinase inhibitors to control the cancer. And more recently, we now develop a new class of immunotherapies, and these are checkpoint inhibitors, which then takes away the camouflage of the cancer so that it enables our immune system to attack the cancer cells. So these are some of the approaches that we take with our patients with advanced kidney cancers.
So does it happen if they didn't have follow-up visits when it was detected in the early stages, or didn't follow up with the treatment, that it metastasized or spread to the different parts of the body?
Yeah, well, kidney cancer can spread in different means. Now, some kidney cancers start out very aggressive, and so they'll spread early, and you diagnose it. Even if you diagnose it early, it's already spread. But thankfully, most don't. Most grow slowly over time without spreading. And then it can spread via blood or via lymphatics, other ways of cancer spread. And so what Dr. Sal is referring to are medications that can target those patients that have kidney cancer that has left the kidney.
I see. So very important when they have the nephrectomy or the partial kidney removed, the surgeon has to be experienced in terms of how many years the surgeon has been performing these surgeries. It's a serious condition.
Absolutely. And one of the things about the more advanced kidney cancers, we spend a lot of time talking about the early kidney cancer, which is thankfully the majority of them. And those patients do very well if they're treated at the right place with the right experience. But advanced kidney cancer requires a lot of different types of doctors. And so Dr. Sal and I and Jillian, we work together with the advanced patients because they also, yes, they'll require surgery. They'll also require immunosystemic therapy, drugs to treat the metastatic disease. So this is multimodal, different modalities of treatment. And maybe, Dr. Sal, you can comment a little bit on why our program at Mount Sinai is unique in that way.
Absolutely. So we used to think that all kidney cancers should be treated the same. When patients develop metastatic or advanced kidney cancers, that we should use therapy A, followed that by therapy B, then therapy C. But this has all changed. I would like to tell the audience that it is very important that we look at every patient as a patient, but not so much just the cancer itself. So I would say that for every patient that walk into Mount Sinai, we look at the patient's availability of the treatment. It depends really on the resources they can have in terms of their ability to get treatment, as well as their overall body condition, or whether they have comorbidities that may prevent them from certain type of treatments. And those are really important factors where we as a group, as a multidisciplinary team who treats kidney cancers, decides upon, because based on that, then we could kind of develop the type of treatment that we think the patients would benefit the most from.
I mean, there's always new innovations and new methods coming up, and I think clinical trials are one good way of understanding, evidence methods, evidence-proven methods, because the trials are continued and they're done properly. The research is conducted over here for your cancer patients.
Absolutely, and and I don't want people to think of clinical trials as, an experimental way to get a drug that has bad effect. A lot of the clinical trials we do actually don't have ill effects. You might actually not get something, or you might get something that could help but doesn't give you a negative side effect.
Yes.
And so offering these things to patients that otherwise don't have a lot of other options is really the way to move forward.
So you use different drugs, or you try to look at the association of some risk factors of some drugs and how they interact with the kidney cancer patients?
Yeah, and it's not just drugs, it's surgical treatments, it's technology, it's imaging, MRIs, how do we diagnose things. So there's a whole lot of different aspects to it. It's even the integrative approach. There's certain things we can do to help the drugs, traditional drugs. So you got to look at it 360
So the
degrees.
research, the trials that you're doing is also using the integrative approach as well?
So
in
yeah,
this trial?
so Jillian's done some work with acupuncture in these trials.
I see.
For various kidney things, including kidney stones. You've done some work.
Yeah, we've done some for treating post-operative pain. So again, we're really trying to look at the whole person and work with them throughout the whole process, manage their symptoms, and if we can do it from a non-drug approach, that's
Yes.
great. If we need to use medicines, that's also fine. But we try to use the least invasive things that
So
we
for
can.
kidney stones, you use some non-traditional methods as well?
Well, we just did a study testing acupuncture to see if it reduced post-operative pain
I see.
after surgery. So
And it did help?
It did help, actually. So it was exciting pilot study, and maybe we'll continue the
That's
research.
interesting. You know, the Mount Sinai is working from different levels, and it's multi-tiered, and when you integrate medicine, I think it really has more positive outcomes.
Yeah, the future of cancer treatment is precision, as Dr. Tsao alluded to, precision medicine, personalized medicine,
Yes.
where you know the specific biology of someone's cancer.
Yes.
Even if it's kidney, it's different for this person versus that person. And so you individualize the treatment from start through finish, and hopefully that will be the future.
Right. And what do you think is the future of kidney cancer in terms of modalities of treatment, of course, from the clinical trials and beyond?
Yeah, well, hopefully, again, we're working out these things now, and as you know, clinical trials, results, outcomes take some time to mature and really get answers for. But hopefully, where we want to go is determining who has kidney cancer that requires treatment,
Yes.
who may have a cancer because they're older or sicker, or maybe higher risk for other medical problems that may not need to be treated.
Right.
And then, on top of that, if someone has advanced disease, actually targeting the drug that is most effective for that particular patient.
Correct.
And so that's the foundation we're working on now, where we're collecting that information. We're keeping that. We have a biobank for all of our patients that have kidney tumors. So hopefully at some point in the future, we can go back and test drugs on their own tumor
Right.
later.
Interesting.
Right.
That's really interesting. So it's all about patient-centered care. And we see the balls with the doctors here, and this is all about...
That's for you.
Thank you. It's all about awareness. It's all about awareness. This show is all about prevention and health promotion and creating that exponential awareness through these shows. And the takeaway for today's show is keep yourself hydrated. Please check your blood pressure regularly. That is so very important. I want to thank Dr. Ketan Badani, Professor Jillian Capodice, and Dr. Tsao for this great, insightful perspectives that you put out on kidney cancer. I'm Renee Mehrra. Until next week, stay healthy, stay positive.